Question 1. The evaluation methodology shows that when a certified medical surgical registered nurse is caring for a patient who has lost decision-making capacity and whose family is requesting a significant change in end-of-life care, the nurse should first take which of the following actions? Option A. Proceed with care changes based on the nurse's professional judgment of what is in the patient's best interest. Option B. Immediately implement the family's requested change in care to honor their wishes. Option C. Contact the hospital's legal department to initiate proceedings for a court-appointed guardian. Option D. Review the patient's medical record for any existing advance directives and identify the designated healthcare agent. Correct answer is D. Review the patient's medical record for any existing advance directives and identify the designated healthcare agent. Explanation. The evaluation methodology shows that understanding legal documents related to end-of-life care is paramount for certified medical surgical registered nurses. This scenario is professionally challenging because it involves navigating complex ethical and legal considerations at a highly sensitive time for patients and their families. Nurses must balance patient autonomy, beneficence, non-maleficence, and justice while adhering to legal mandates. Careful judgment is required to ensure that patient wishes are respected and that care aligns with established legal frameworks. The correct approach represents best professional practice because it prioritizes direct communication with the patient and their designated healthcare agent, ensuring that decisions are made based on the patient's expressed wishes and legal directives. This aligns with the fundamental ethical principle of patient autonomy and the legal requirement to honor advance directives and durable power of attorney for healthcare. By consulting these documents and the designated agent, the nurse upholds the patient's right to self-determination in end-of-life care decisions, preventing potential legal disputes and ensuring compassionate, patient-centered care. An incorrect approach that involves proceeding with a significant change in care based solely on a family member's verbal request, without verifying their legal authority or the patient's current wishes, represents a significant regulatory and ethical failure. This disregards the legal standing of advance directives and the designated healthcare agent, potentially violating patient autonomy and leading to inappropriate care. It also exposes the healthcare facility to legal liability for failing to follow established protocols for end-of-life decision-making. Another incorrect approach, such as delaying care changes until a formal court order is obtained when a clear healthcare agent and advance directive exist, is also professionally unacceptable. This creates unnecessary delays in providing care that may be urgently needed and is contrary to the principles of efficient and patient-centered care. It also demonstrates a lack of understanding of the legal weight of properly executed advance directives and healthcare power of attorney documents. A further incorrect approach, such as making decisions based on the nurse's personal beliefs about what is best for the patient, is a direct violation of the ethical principle of patient autonomy and professional boundaries. This constitutes a failure to respect the patient's right to make their own decisions, even if those decisions differ from the nurse's personal values. It can lead to a breakdown of trust and significant ethical and legal repercussions. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the patient's current condition and care needs. 2. Ascertain if the patient has any advance directives, e.g., living will, healthcare power of attorney. 3. If advance directives exist, review them to understand the patient's stated wishes and identify the designated healthcare agent. 4. If a healthcare agent is designated, communicate with them to confirm their understanding of the patient's wishes and to discuss current care decisions. 5. If the patient lacks capacity and has no advance directive or designated agent, follow institutional policy and legal guidelines for surrogate decision-making, which may involve consulting family members in a hierarchical order or seeking legal counsel. 6. Document all communications, decisions, and actions meticulously in the patient's medical record. Question 2. Upon reviewing the arterial blood gas results of a patient experiencing shortness of breath and confusion, which of the following interpretations, when considered in isolation without further clinical correlation, would most likely lead to an inappropriate nursing intervention? Option A. A pH of 7.45 Pa CO2 of 38 mmHg and HCO3 of 25 mx/L. Option B. A pH of 7.25 Pa CO2 of 60 mmHg and HCO3 of 28 mx/L. Option C. A pH of 7, 35 Pa CO2 of 45 mmHg, and HCO3 of 24 mx/L. Option D. A pH of 7, 50 Pa CO2 of 30 mmHg, and HCO3 of 22 mx/L. The correct answer is B. A pH of 7, 25 Pa CO2 of 60 mmHg, and HCO3 of 28 mx/L. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of acid-base balance in patient care. A registered nurse must accurately interpret complex physiological data and apply knowledge of acid-base disturbances to ensure appropriate and timely interventions. Challenge lies in distinguishing between different types of acid-base imbalances and understanding their underlying causes and potential consequences, all while adhering to established nursing standards and regulatory guidelines. Misinterpretation can lead to delayed or incorrect treatment, potentially harming the patient. Correct approach analysis. The correct approach involves a systematic assessment of the patient's clinical presentation, vital signs, and laboratory results, specifically focusing on arterial blood gas, AB values. A thorough understanding of the relationship between pH, PaCO2, and HCO3 is essential. For instance, recognizing that a low pH with a low PaCO2 and normal or low HCO3 suggests respiratory alkalosis, or a low pH with a high PaCO2 and normal or high HCO3 indicates respiratory acidosis, is fundamental. The nurse's role is to identify the primary acid-base disturbance and then correlate it with the patient's clinical signs and symptoms to determine the underlying cause and guide nursing interventions, such as administering prescribed oxygen therapy, assisting with ventilation, or monitoring fluid and electrolyte balance, all within the scope of practice as defined by the nursing regulatory body. This aligns with the professional obligation to provide safe, competent, and evidence-based care. Incorrect approaches analysis. One incorrect approach would be to solely focus on the pH value without considering the compensatory mechanisms indicated by PaCO2 and HCO3. This could lead to misdiagnosis, as a compensated acid-base disorder might appear to have a near-normal pH, masking a significant underlying problem. Another incorrect approach is to assume a metabolic cause for every acid-base imbalance without a comprehensive assessment of respiratory status and potential contributing factors like renal function or medication administration. This overlooks the interconnectedness of the body's regulatory systems and can lead to inappropriate interventions. Furthermore, acting solely on a single laboratory value without clinical correlation is a significant ethical and regulatory failure, as nursing practice requires a holistic patient assessment. Relying on anecdotal evidence or outdated protocols instead of current evidence-based practice guidelines also constitutes a failure to meet professional standards of care. Professional reasoning. Professionals should employ a structured decision-making process that begins with a comprehensive patient assessment, including a review of the medical history, current medications, and presenting signs and symptoms. This is followed by the interpretation of relevant diagnostic data, such as ABGs, in the context of the patient's overall condition. The nurse then identifies potential acid-base imbalances, considers their likely etiologies, and formulates a plan of care in collaboration with the healthcare team. This plan should include specific nursing interventions aimed at addressing the underlying cause and managing the acid-base disturbance, with continuous monitoring and evaluation of the patient's response. Adherence to institutional policies, professional nursing standards, and regulatory requirements is paramount throughout this process. Question 3. During the evaluation of a post-operative patient reporting persistent and severe pain despite receiving their scheduled opioid analgesic every 4 hours, the registered nurse observes the patient grimacing, guarding their incision site, and refusing to ambulate. The patient states the current medication is not touching the pain. What is the most appropriate nursing action? Option A. Contact the prescribing physician to report the patient's uncontrolled pain and request an evaluation for potential medication adjustment. Option B. Administer an additional dose of the prescribed opioid analgesic as the patient is clearly in distress. Option C. Continue with routine care and reassess the patient's pain in another 4 hours as per the medication schedule. Option D. Document the patient's pain as controlled, assuming the medication is working as intended and the patient's perception is inaccurate. The correct answer is A. Contact the prescribing physician to report the patient's uncontrolled pain and request an evaluation for potential medication adjustment. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in medical surgical nursing. Managing a patient's pain medication when the prescribed dosage appears insufficient based on the patient's subjective report and objective signs of distress. The challenge lies in balancing the physician's orders with the nurse's professional responsibility to advocate for the patient and ensure effective pain management, while also adhering to safe medication administration practices and institutional policies. The nurse must assess the situation thoroughly, consider potential contributing factors, and determine the most appropriate course of action without compromising patient safety or overstepping professional boundaries. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's pain, including its characteristics, severity, and impact on function. This assessment should then be communicated to the prescribing physician, along with the nurse's clinical observations and the patient's subjective report. This collaborative communication allows the physician to reevaluate the medication regimen and make an informed decision about potential adjustments. This aligns with the nurse's ethical and professional duty to advocate for the patient's well-being and ensure adherence to safe medication practices as outlined by nursing practice acts and institutional policies, which emphasize the importance of accurate assessment and communication for effective patient care. Incorrect approaches analysis. Administering an additional dose of the prescribed opioid without consulting the physician is a significant regulatory and ethical failure. This constitutes a deviation from the physician's orders and could lead to medication errors, such as overdose, respiratory depression, or other adverse drug events. This action violates the principle of administering medications only as prescribed and documented, and it bypasses the established chain of command for medication management, potentially leading to legal repercussions and disciplinary action. Documenting the patient's pain as controlled despite their subjective report and objective signs of distress is also a failure. This misrepresentation of the patient's condition is a breach of documentation standards and can lead to inadequate pain management, patient suffering, and potential harm. Accurate and honest documentation is a legal and ethical requirement, reflecting the true clinical picture and guiding subsequent care decisions. Ignoring the patient's complaints of pain and continuing with routine care without further assessment or intervention is a failure to provide adequate pain management. This neglects the nurse's fundamental responsibility to alleviate suffering and can result in patient dissatisfaction, delayed recovery, and potential complications related to uncontrolled pain. It also undermines the therapeutic relationship and the patient's trust in the healthcare team. Professional reasoning. Professionals should employ a systematic approach to medication management challenges. This involves 1. Thorough patient assessment, subjective and objective data. 2. Review of the medication order and patient's history. 3. Identification of any discrepancies or concerns. 4. Clear and concise communication with the prescriber, presenting findings and seeking clarification or adjustment. 5. Accurate and timely documentation of all assessments, communications, and interventions. 6. Ongoing evaluation of the patient's response to treatment. This framework ensures patient safety, adherence to regulation, and ethical practice. Question 4. Process analysis reveals that a patient undergoing targeted therapy for a specific type of lung cancer is experiencing a new onset of fatigue and dyspnea. Considering the principles of cancer biology and the mechanism of action of targeted therapies, which nursing approach best addresses the potential impact of these symptoms on the patient's treatment and overall well-being? Option A. Assess the patient's fatigue and dyspnea in the context of the targeted therapy's known side effect profile and the specific molecular targets of the drug, correlating these symptoms with potential cellular-level impacts or off-target effects. Option B. Administer prescribed antiemetics and analgesics to manage the patient's discomfort, assuming these symptoms are common, nonspecific side effects of cancer treatment. Option C. Advise the patient to rest and hydrate, suggesting that fatigue and dyspnea are general symptoms of advanced cancer and likely unrelated to the targeted therapy. Option D. Document the patient's reported fatigue and dyspnea and inform the physician at the next scheduled follow-up appointment, as these symptoms are not immediately life-threatening. The correct answer is A. Assess the patient's fatigue and dyspnea in the context of the targeted therapy's known side effect profile and the specific molecular targets of the drug, correlating these symptoms with potential cellular-level impacts or off-target effects. Explanation: this scenario is professionally challenging due to the inherent complexity of cancer biology and the rapid advancements in treatment modalities. Nurses must possess a deep understanding of cellular mechanisms, genetic mutations, and the tumor microenvironment to effectively assess patient responses and anticipate potential complications. The challenge lies in translating this intricate biological knowledge into practical, patient-centered care within the established regulatory framework for medical surgical nursing. The correct approach represents best professional practice because it prioritizes evidence-based intervention directly linked to the patient's specific cancer biology and treatment plan. This aligns with the core tenets of patient safety and quality care mandated by Nursing Practice Acts and professional standards. By focusing on the molecular underpinnings of the patient's disease and treatment, the nurse can proactively identify potential adverse events, optimize therapeutic efficacy, and provide accurate, individualized patient education. This approach demonstrates a commitment to lifelong learning and the application of scientific knowledge to clinical decision-making, which is a cornerstone of advanced nursing practice. An incorrect approach that focuses solely on superficial symptoms without considering the underlying cancer biology fails to meet the standard of care. This oversight could lead to delayed recognition of treatment resistance, progression of disease, or severe adverse drug reactions, potentially violating the nurse's duty to provide competent care and act in the patient's best interest. Another incorrect approach that relies on outdated or unverified information about cancer biology or treatment would constitute a breach of professional responsibility, as it deviates from current scientific understanding and evidence-based practice, potentially harming the patient. Professionals should employ a decision-making process that begins with a thorough assessment of the patient's diagnosis, including the specific type of cancer, its stage, and any known genetic markers. This should be followed by a comprehensive review of the prescribed treatment regimen and its known mechanisms of action and potential side effects. Informed by current research and guidelines, the nurse should then integrate this knowledge with the patient's individual clinical presentation and response to therapy, continuously evaluating and adapting care plans as needed. Collaboration with the interdisciplinary team, including oncologists and pharmacists, is crucial for complex cases. Question 5. Consider a scenario where a 72-year-old patient admitted with severe dehydration and a history of alcohol abuse is to begin nutritional support. The patient presents with significant muscle wasting and a serum albumin of 2.8 g/dl. The medical team has ordered the initiation of enteral nutrition. As the nurse responsible for this patient's care, what is the most appropriate initial approach to administering this nutritional support? Option A. Delay the initiation of enteral feeding until the patient's hydration status has significantly improved and electrolyte levels are normalized. Option B. Initiate enteral feeding at a low caloric rate, gradually increasing over several days while closely monitoring electrolyte levels. Option C. Administer nutritional support based on the patient's stated preference for oral intake, even if it is insufficient. Option D. Begin enteral feeding at the prescribed full rate, as the patient requires immediate caloric replacement. The correct answer is D. Begin enteral feeding at the prescribed full rate, as the patient requires immediate caloric replacement. Explanation: scenario analysis. This scenario presents a common yet complex challenge in medical surgical nursing, managing a patient with significant nutritional deficits and a high risk for refeeding syndrome. The patient's history of malnutrition, coupled with the acute illness requiring hospitalization, necessitates a careful and systematic approach to nutritional support. The professional challenge lies in balancing the urgent need to provide adequate nutrition with the critical risk of precipitating refeeding syndrome, a potentially life-threatening metabolic complication. This requires a deep understanding of the pathophysiology of refeeding, the specific patient's risk factors, and the appropriate evidence-based interventions. Correct approach analysis. The correct approach involves initiating nutritional support cautiously, starting with a low caloric intake and gradually increasing it while closely monitoring electrolyte levels, particularly phosphorus, potassium, and magnesium. This aligns with current evidence-based guidelines for managing malnourished patients at risk for refeeding syndrome. The rationale is to allow the patient's metabolic system to adapt gradually to the influx of carbohydrates, thereby preventing rapid shifts in fluid and electrolytes that characterize refeeding syndrome. This proactive monitoring and staged refeeding strategy directly addresses the primary risk and is a cornerstone of safe and effective nutritional management in this population, reflecting professional accountability and adherence to best practices as outlined by nursing standards of care. Incorrect approaches analysis. Initiating nutritional support at a high caloric level without gradual titration and electrolyte monitoring is a significant regulatory and ethical failure. This approach disregards the established risks of refeeding syndrome and demonstrates a lack of adherence to evidence-based practice, potentially leading to patient harm. Such an action could be considered a breach of the nursing standard of care, failing to protect the patient from foreseeable harm. Administering nutritional support solely based on patient preference without a thorough assessment of their nutritional status and refeeding risk is also professionally unacceptable. Patient autonomy is important. It must be balanced with the nurse's responsibility to provide safe and effective care based on clinical assessment and established medical protocols. Ignoring clinical indicators of malnutrition and refeeding risk in favor of patient preference alone can lead to adverse outcomes and constitutes a failure to uphold professional duties. Delaying nutritional support indefinitely due to fear of refeeding syndrome without implementing appropriate risk mitigation strategies is another failure. While caution is warranted, prolonged malnutrition exacerbates the patient's condition and can lead to further complications. A balanced approach that involves careful assessment, risk stratification, and staged intervention is required, rather than complete avoidance of necessary nutritional support. This inaction can be viewed as a failure to provide timely and appropriate care. Professional reasoning. Professionals should approach this situation by first conducting a comprehensive nutritional assessment, identifying risk factors for refeeding syndrome. This includes reviewing medical history, current medications, and laboratory values. Next, they should consult established clinical guidelines and consult with the interdisciplinary team, including physicians and dietitians, to develop a personalized nutrition plan. The plan should prioritize gradual refeeding, starting with a low caloric intake and carefully monitoring electrolyte levels and vital signs. Continuous reassessment and adjustment of the plan based on the patient's response are crucial. This systematic, evidence-based, and collaborative approach ensures patient safety and optimal outcomes. Question 6. The review process indicates that a registered nurse is conducting a comprehensive health history on a new patient admitted for management of chronic pain. During the interview, the patient becomes visibly uncomfortable when asked about their past substance use history and states, "I don't want to talk about that. It's not relevant to my pain." The nurse needs to obtain this information to ensure safe and effective pain management and to identify potential contributing factors or contraindications for treatment. Which of the following actions best reflects professional and ethical practice in this situation? A. Gently explain to the patient that, while their feelings are understood, information about past substance use is crucial for developing a safe and effective pain management plan, and explore their specific concerns about discussing it. B. Proceed with the health history, documenting the patient's reluctance, but continuing to ask detailed questions about their substance use to ensure all necessary data is collected. C. Acknowledge the patient's discomfort and immediately move on to the next section of the health history, deciding that the information is not essential for pain management. D. Inform the patient that providing a complete history is a requirement for admission and that the nurse cannot proceed without this information. Option A. Acknowledge the patient's discomfort and immediately move on to the next section of the health history, deciding that the information is not essential for pain management. Option B. Proceed with the health history, documenting the patient's reluctance, but continuing to ask detailed questions about their substance use to ensure all necessary data is collected. Option C. Gently explain to the patient that, while their feelings are understood, information about past substance use is crucial for developing a safe and effective pain management plan, and explore their specific concerns about discussing it. Option D. Inform the patient that providing a complete history is a requirement for admission and that the nurse cannot proceed without this information. The correct answer is C. Gently explain to the patient that, while their feelings are understood, information about past substance use is crucial for developing a safe and effective pain management plan, and explore their specific concerns about discussing it. Explanation. This scenario presents a professional challenge due to the conflict between a patient's stated desire for privacy regarding their health history and the nurse's professional obligation to gather comprehensive information for safe and effective care. The nurse must navigate the ethical principles of patient autonomy and beneficence while adhering to regulatory requirements for accurate health record documentation. The core of the challenge lies in balancing the patient's right to control their personal information with the healthcare team's need for complete data to prevent medical errors and ensure appropriate treatment. The correct approach represents best professional practice because it prioritizes open communication, patient education, and collaborative decision-making. By explaining the rationale behind the need for specific information and offering alternatives for disclosure, the nurse upholds the patient's autonomy while still striving to obtain necessary data. This aligns with the ethical guidelines that emphasize informed consent and patient-centered care. Furthermore, it respects the patient's dignity and builds trust, which are foundational to a therapeutic nurse-patient relationship. This approach also implicitly adheres to regulations that require accurate and complete patient records, as it seeks to achieve this through consent and understanding rather than coercion. An incorrect approach that involves disregarding the patient's reluctance and proceeding with the history-taking without further discussion would be a regulatory and ethical failure. This would violate the patient's right to privacy and autonomy, potentially leading to a breach of trust and a negative patient experience. It would also be seen as a failure to obtain informed consent for the collection of personal health information, which is a cornerstone of many healthcare regulations. Another incorrect approach, such as abandoning the history-taking altogether without attempting to understand the patient's concerns or explain the importance of the information, would also be professionally unacceptable. This would compromise patient safety by leaving the healthcare team with incomplete information, potentially leading to misdiagnosis or inappropriate treatment. It represents a failure to fulfill the nurse's professional duty of care and could be a violation of standards of practice that mandate thorough patient assessments. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the patient's concerns. Second, clearly and respectfully explain the clinical relevance and necessity of the information being requested, linking it directly to their care and safety. Third, explore the patient's reasons for reluctance and offer alternative ways to obtain the information, such as focusing on specific areas or allowing them to share information at their own pace. Fourth, document the patient's expressed concerns and the nurse's efforts to address them, along with any information that was successfully obtained. Finally, consult with the healthcare team or a supervisor if significant barriers to care arise due to incomplete information. Question 7. Which approach would be most effective in implementing a comprehensive fall prevention strategy for a medical surgical patient identified as being at moderate risk for falls? Option A. Restricting all patient ambulation to only when absolutely necessary and ensuring the call bell is always within reach. Option B. Implementing a standardized fall risk assessment tool, developing an individualized care plan based on identified risks, and educating the patient and family on prevention strategies. Option C. Delegating all fall prevention interventions to unlicensed assistive personnel without direct registered nurse supervision. Option D. Relying solely on environmental modifications such as ensuring clear pathways and adequate lighting. Correct answer is B. Implementing a standardized fall risk assessment tool, developing an individualized care plan based on identified risks, and educating the patient and family on prevention strategies. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in medical surgical nursing, ensuring patient safety in the face of individual risk factors and environmental hazards. The professional challenge lies in balancing patient autonomy and comfort with the imperative to prevent harm, specifically falls, which can lead to significant morbidity and mortality. Careful judgment is required to implement effective, individualized strategies without overrestricting patient mobility or causing undue distress. Correct approach analysis. The correct approach represents best professional practice because it is rooted in a comprehensive, individualized assessment and a multifaceted intervention plan. This aligns with the core tenets of patient-centered care and the nursing process, emphasizing proactive risk identification and mitigation. Regulatory frameworks, such as those governing nursing practice and patient safety, e.g., Joint Commission standards in the U.S., or equivalent national patient safety goals, Mandate thorough risk assessments and the implementation of evidence-based fall prevention strategies. Ethically, this approach upholds the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approach is analysis, an approach that relies solely on universal, non-individualized interventions, such as placing all patients in low Fowler's position or restricting all visitors, fails to acknowledge the unique needs and risks of each patient. This can lead to patient dissatisfaction, decreased mobility, and potentially other complications, while not effectively targeting the actual fall risks. This approach may violate regulatory requirements for individualized care plans and ethical principles of respecting patient dignity and autonomy. An approach that delegates all fall prevention tasks to unlicensed assistive personnel without adequate supervision or clear direction, or without the registered nurse conducting a thorough initial assessment, represents a failure in professional accountability and scope of practice. Regulatory bodies clearly define the RN's responsibility for patient assessment, care planning, and evaluation. This delegation without proper oversight can lead to gaps in care and potential harm, violating professional standards and potentially regulatory mandates regarding supervision. An approach that focuses exclusively on environmental modifications without addressing the patient's intrinsic risk factors, e.g., gait instability, cognitive impairment, medication side effects, is incomplete. While a safe environment is crucial, it is only one component of a comprehensive fall prevention strategy. This incomplete approach may not adequately mitigate the identified risks and could be seen as a failure to meet the comprehensive standard of care expected by regulatory bodies. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough, individualized patient assessment. This assessment should identify intrinsic risk factors, e.g., age, medical conditions, medications, cognitive status, mobility limitations, and extrinsic factors, e.g., environment, footwear, assistive devices. Based on this assessment, a personalized care plan should be developed collaboratively with the patient and interdisciplinary team, incorporating evidence-based interventions. Regular reevaluation of the patient's risk status and the effectiveness of interventions is crucial. This process ensures that care is both safe and patient-centered, adhering to regulatory requirements and ethical obligations. Question 8. Risk assessment procedures indicate that a patient admitted with a suspected subarachnoid hemorrhage is experiencing intermittent periods of agitation and confusion. The nurse is tasked with monitoring this patient. Which of the following nursing actions best reflects a proactive and comprehensive approach to managing this patient's neurological status? Option A. Immediately initiate a comprehensive neurological assessment including level of consciousness, pupillary response, motor strength, and sensory function, and report any new or worsening deficits to the physician promptly. Option B. Administer prescribed sedatives to manage the patient's agitation and confusion, then reassess in 2 hours. Option C. Ask the patient's family to monitor for any changes in behavior and report them to the nursing staff. Option D. Perform a focused neurological assessment every 4 hours, documenting findings and reporting any significant changes to the physician. The correct answer is D. Perform a focused neurological assessment every 4 hours, documenting findings and reporting any significant changes to the physician. Explanation. Scenario analysis. This scenario is professionally challenging due to the potential for rapid neurological deterioration and the critical need for timely, accurate assessment and intervention. The nurse must balance the patient's immediate comfort with the imperative to identify subtle changes that could signal a worsening condition, all while adhering to established protocols and ensuring patient safety. The complexity arises from the subjective nature of some neurological assessments and the potential for misinterpretation of findings. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based assessment that directly addresses the patient's neurological status and potential complications. This aligns with the core principles of medical surgical nursing, emphasizing patient safety, accurate data collection, and timely communication with the healthcare team. Adherence to established nursing standards of care and facility protocols for neurological assessment is paramount. This approach ensures that any deviation from the patient's baseline is identified promptly, allowing for appropriate medical and nursing interventions to prevent adverse outcomes. It reflects a commitment to patient advocacy and the delivery of high-quality care as mandated by professional nursing practice guidelines. Incorrect approaches analysis. One incorrect approach involves delaying a comprehensive neurological assessment based on the patient's current comfort level. This fails to recognize that neurological conditions can deteriorate rapidly and silently. Ethically, this constitutes a breach of the duty of care, as it neglects the potential for harm by not proactively monitoring for changes. Legally, it could be considered negligence if a delayed assessment leads to a worse patient outcome. Another incorrect approach is to rely solely on vital signs without performing a detailed neurological examination. While vital signs are important, they are not always sensitive indicators of neurological compromise. This approach overlooks specific neurological assessment parameters crucial for detecting issues like altered mental status, cranial nerve deficits, or motor/sensory changes. This is a failure to meet the professional standard of care for neurological patients and could lead to misdiagnosis or delayed treatment. A third incorrect approach is to delegate the primary neurological assessment to an unlicensed assistive personnel without direct RN supervision and validation of findings. While UAP can assist with certain tasks, the critical assessment and interpretation of neurological status remain the responsibility of the registered nurse. This delegation failure violates nursing scope of practice regulations and ethical principles of accountability, potentially compromising patient safety. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's diagnosis and potential complications. This involves recalling and applying established nursing assessment protocols for neurological disorders. The nurse should then perform a comprehensive assessment, prioritizing objective findings and comparing them to the patient's baseline. Crucially, the nurse must critically analyze the data, identifying any deviations that warrant further investigation or intervention. Effective communication with the interdisciplinary team, including physicians and other nurses, is essential for collaborative care planning and timely management. Continuous reassessment and adaptation of the care plan based on the patient's evolving condition are also vital components of professional practice. Question 9. Stakeholder feedback indicates that some patients undergoing diagnostic procedures for gastrointestinal disorders express significant apprehension and a desire to postpone the procedure due to discomfort. As a certified medical surgical registered nurse, what is the most appropriate initial approach when a patient expresses such concerns prior to a scheduled gastrointestinal diagnostic test? Option A. Proceed with the diagnostic procedure as scheduled, reassuring the patient that their discomfort is a common reaction and will be managed during the test. Option B. Inform the patient that their apprehension is likely due to embarrassment and that it is important to proceed with the test for their health, encouraging them to overcome their feelings. Option C. Engage in a detailed discussion with the patient to understand the specific nature of their apprehension. Explain the diagnostic purpose and benefits of the procedure, and explore strategies to alleviate their discomfort. Option D. Immediately cancel the diagnostic procedure and document the patient's refusal, advising them to reschedule when they feel more comfortable. The correct answer is C. Engage in a detailed discussion with the patient to understand the specific nature of their apprehension, explain the diagnostic purpose and benefits of the procedure, and explore strategies to alleviate their discomfort. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance patient autonomy, the need for accurate diagnostic information, and the potential for patient distress or misunderstanding regarding a sensitive gastrointestinal disorder. The nurse must navigate the ethical imperative to respect the patient's wishes while also ensuring they receive appropriate care and understand the implications of their choices. The specific nature of gastrointestinal disorders can involve discomfort, embarrassment, and a need for privacy, further complicating the interaction. Correct approach analysis. The correct approach prioritizes patient education and shared decision-making, aligning with the ethical principles of beneficence, non-maleficence, and autonomy. By explaining the diagnostic purpose of the procedure and addressing the patient's concerns, the nurse empowers the patient to make an informed decision. This respects their right to self-determination while ensuring they understand the potential benefits of the diagnostic test for their health. This approach is supported by nursing practice standards that emphasize patient advocacy and the provision of clear, understandable information to facilitate informed consent. Incorrect approaches analysis. One incorrect approach involves proceeding with the diagnostic procedure without fully addressing the patient's expressed discomfort or providing adequate education. This violates the principle of autonomy by disregarding the patient's concerns and potentially proceeding without true informed consent. It also risks causing unnecessary distress, contravening the principle of non-maleficence. Furthermore, it fails to uphold the nurse's role as an advocate, potentially leading to a negative patient experience and distrust in the healthcare system. Another incorrect approach is to dismiss the patient's concerns as simply being embarrassed and to proceed with the procedure without further investigation or discussion. This demonstrates a lack of empathy and fails to recognize that patient apprehension can stem from a variety of factors, including fear of pain, misunderstanding of the procedure, or previous negative experiences. This approach neglects the nurse's responsibility to assess the patient's readiness and understanding, potentially leading to a compromised diagnostic outcome due to patient anxiety or non-cooperation. A third incorrect approach would be to immediately cancel the procedure based solely on the patient's initial expression of discomfort, without exploring the underlying reasons or offering alternative solutions or reassurance. While patient comfort is important, a complete cancellation without further assessment might deprive the patient of necessary diagnostic information, potentially delaying diagnosis and treatment of a serious gastrointestinal disorder, thus failing the principle of beneficence. Professional reasoning. Professionals should employ a patient-centered approach that involves active listening, empathetic communication, and thorough education. When faced with patient apprehension regarding a diagnostic procedure for a gastrointestinal disorder, the nurse should 1. Acknowledge and validate the patient's feelings. 2. Inquire about the specific nature of their discomfort or concerns. 3. Provide clear, jargon-free explanations of the procedure, its purpose, and expected sensations. 4. Discuss potential benefits and risks. 5. Explore alternative diagnostic options if available and appropriate. 6. Offer strategies to manage discomfort, such as relaxation techniques or pain management. 7. Reassess the patient's understanding and willingness to proceed. This systematic approach ensures that patient autonomy is respected, their well-being is prioritized, and the most appropriate course of action is determined collaboratively. Question 10. The investigation demonstrates that a medical surgical unit's established protocol for managing a specific patient condition has not been updated in 5 years, while recent evidence-based practice guidelines from a reputable nursing organization recommend a significantly different approach that has shown improved patient outcomes in peer-reviewed studies. A registered nurse on the unit is aware of these updated guidelines. What is the most professionally appropriate course of action for this nurse to take? Option A. Begin implementing the new evidence-based practice recommendations independently for patients under their care, as it is clearly superior to the current protocol. Option B. Research the latest evidence-based practice guidelines, gather supporting data, and present this information to the unit manager and the hospital's evidence-based practice committee to advocate for a protocol revision. Option C. Inform colleagues about the new guidelines during informal discussions, hoping that widespread awareness will eventually lead to a change in practice. Option D. Continue to follow the existing unit protocol as it has been the standard of care and has not resulted in any reported adverse events. The correct answer is B. Research the latest evidence-based practice guidelines, gather supporting data, and present this information to the unit manager and the hospital's evidence-based practice committee to advocate for a protocol revision. Explanation. Scenario analysis. This scenario presents a common challenge in medical surgical nursing, where established unit protocols may not align with the latest evidence-based practice (EP) recommendations. The challenge lies in balancing the need for standardized care with the imperative to adopt superior, evidence-backed interventions. Nurses are ethically and professionally obligated to provide the highest quality of care, which necessitates staying current with EBP. However, they must also navigate existing organizational policies and the potential resistance to change from colleagues or established practices. Correct approach analysis. The correct approach, which involves a nurse proactively researching the latest EBP guidelines and presenting them to the unit manager and evidence-based practice committee, represents best professional practice. This aligns with the American Nurses Association (ANA) standards of practice, specifically the standard of professional performance, quality and safety, which mandates nurses to use evidence to guide practice. Ethically, this upholds the principle of beneficence by seeking to improve patient outcomes through the most effective means. It also demonstrates professional accountability and leadership in advocating for patient well-being. This approach respects the organizational structure by seeking approval and collaboration rather than unilaterally implementing changes. Incorrect approach is analysis. One incorrect approach involves continuing to follow the outdated unit protocol despite awareness of newer EBP. This failure to integrate current evidence into practice violates the ANA standards of practice and the ethical obligation to provide competent care. It could lead to suboptimal patient outcomes and potentially expose the nurse and institution to liability. Another incorrect approach is to unilaterally implement the new EBP without consulting unit management or the EBP committee. While well-intentioned, this bypasses established organizational processes for policy change and can undermine team cohesion and trust. It disregards the need for collective buy-in and resource allocation that may be necessary for successful implementation, potentially violating organizational policies and professional conduct guidelines that emphasize collaboration and adherence to established procedures. A third incorrect approach is to dismiss the new EBP as irrelevant because the current protocol has not resulted in adverse events. This demonstrates a reactive rather than proactive approach to quality improvement. The absence of adverse events does not equate to optimal care. EBP aims to enhance effectiveness and efficiency, not just prevent harm. This stance fails to uphold the professional responsibility to continuously seek better ways to care for patients. As outlined in nursing professional standards, professional reasoning, when faced with a discrepancy between current practice and emerging EBP, a nurse should employ a systematic approach. First, thoroughly research and understand the new EBP, including its supporting evidence and potential benefits. Second, identify relevant stakeholders within the healthcare setting, such as unit managers, EBP committees, and potentially medical staff. Third, prepare a clear and concise presentation of the EBP, highlighting its advantages and addressing potential implementation challenges. Fourth, engage in collaborative discussion to advocate for the adoption of the new practice, respecting organizational policies and procedures. This process ensures that changes are evidence-based, ethically sound, and implemented in a manner that supports quality patient care and professional accountability. Question 11. The monitoring system demonstrates a trend of slightly elevated vital signs and a decrease in patient mobility over the past 24 hours, prompting a review of the patient's risk assessment for deep vein thrombosis, DVT. Which of the following actions best aligns with a process optimization approach to risk assessment and screening? Option A. Relying on the nurse's clinical experience to determine if the observed changes warrant a DVT diagnosis without using a formal screening tool. Option B. Initiating a stat Doppler ultrasound of the lower extremities based on the observed trend without a formal risk assessment score. Option C. Reviewing the patient's electronic health record for any previously documented DVT risk factors and inputting this information into the validated DVT risk assessment tool integrated within the system. Option D. Consulting with a colleague to get their subjective opinion on the patient's risk level for DVT. The correct answer is C. Reviewing the patient's electronic health record for any previously documented DVT risk factors and inputting this information into the validated DVT risk assessment tool integrated within the system. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the medical surgical registered nurse to interpret data from a monitoring system and apply it to a patient's risk assessment for a specific condition. The challenge lies in accurately identifying subtle indicators that may not be immediately obvious and translating them into a meaningful risk score or intervention plan. The nurse must balance the need for timely intervention with the avoidance of unnecessary alarm fatigue or patient anxiety. This requires a deep understanding of the specific risk assessment tool being used, its limitations, and the clinical context of the patient's overall health status. Correct approach analysis. The correct approach involves the nurse utilizing a validated, evidence-based risk assessment tool that is specifically designed to screen for the condition in question. This tool should be integrated into the electronic health record or readily accessible, allowing for systematic data input and calculation of a risk score. The nurse's role is to ensure accurate data entry, interpret the resulting score in conjunction with the patient's clinical presentation, and initiate appropriate follow-up actions as dictated by the tool's guidelines and institutional policy. This approach represents best professional practice because it ensures a standardized, objective, and reproducible method of risk assessment, minimizing subjective bias. Adherence to validated tools aligns with professional nursing standards and regulatory requirements that mandate evidence-based practice and patient safety. For example, in the U.S., the American Nurses Association ANA Standards of Practice, specifically the Standard on Evaluation, emphasizes the use of systematic and ongoing evaluation to determine the progress toward the attainment of expected outcomes. Furthermore, regulatory bodies like the Joint Commission often mandate the use of evidence-based protocols for patient care, including risk assessment. Incorrect approach is analysis. One incorrect approach would be to rely solely on the nurse's subjective impression or anecdotal experience without employing a structured risk assessment tool. This is professionally unacceptable because it introduces significant bias and lacks the objectivity and reproducibility required for reliable risk assessment. It fails to meet the standard of evidence-based practice and could lead to under- or over-identification of patients at risk, impacting patient safety and resource allocation. Ethically, it violates the principle of beneficence by potentially failing to provide necessary interventions or causing undue harm through unnecessary procedures. Another incorrect approach would be to use a generic screening tool not specifically validated for the condition being monitored, or to misinterpret the parameters of the chosen tool. This is professionally unacceptable as it compromises the accuracy and reliability of the risk assessment. A tool not designed for the specific condition may not capture the relevant risk factors or may assign inappropriate weight to certain indicators, leading to flawed conclusions. This can result in misdiagnoses or false positives, both of which have negative consequences for patient care and can lead to regulatory scrutiny for failure to adhere to accepted standards of care. A third incorrect approach would be to ignore or override the results of a validated risk assessment tool without a clear, documented clinical rationale based on a comprehensive reassessment of the patient. This is professionally unacceptable as it undermines the integrity of the evidence-based process and can be seen as a deviation from established protocols designed to ensure patient safety. Such an action could be considered negligent if it leads to adverse patient outcomes and may violate institutional policies and professional nursing standards that require justification for deviating from evidence-based guidelines. Professional reasoning. Professionals should approach this situation by first identifying the specific condition for which the patient is being monitored and the established risk assessment tool in use. They should then ensure they have a thorough understanding of the tool's components, scoring system, and recommended actions for different risk levels. The process involves systematically collecting the data required by the tool, accurately inputting it, and then interpreting the resulting score within the broader clinical context of the patient. If the score indicates a need for intervention, the nurse should follow the tool's guidelines and institutional protocols for escalation or direct action. If there is a discrepancy between the tool's findings and the nurse's clinical judgment, the nurse should perform a comprehensive reassessment, document the findings meticulously, and consult with the interdisciplinary team, including physicians, to determine the most appropriate course of action. This systematic, evidence-based, and collaborative approach ensures patient safety and adherence to professional and regulatory standards. Question 12. Performance analysis shows a registered nurse is caring for a patient admitted with acute decompensated heart failure. The patient is experiencing significant dyspnea, has audible crackles bilaterally in the lung bases, and reports feeling anxious. The nurse has received a physician's order for intravenous furosemide and oxygen therapy via nasal cannula. Which nursing action should be performed first? Option A. Administer the prescribed intravenous furosemide. Option B. Notify the physician of the patient's current respiratory status. Option C. Assess the patient's pain level and characteristics. Option D. Administer oxygen therapy via nasal cannula at 2L/min and assist the patient to an upright position. The correct answer is D. Administer oxygen therapy via nasal cannula at 2L/min and assist the patient to an upright position. Explanation. Scenario analysis. This scenario presents a common challenge in medical surgical nursing. managing a patient with a complex cardiovascular disorder, specifically acute decompensated heart failure ADV, where rapid assessment and intervention are critical. The challenge lies in prioritizing nursing actions based on the patient's dynamic physiological status and the potential for rapid deterioration, while adhering to established best practices and regulatory guidelines for patient care. The nurse must synthesize multiple data points, including subjective complaints, objective vital signs, and diagnostic findings, to formulate an effective plan. Correct approach analysis. The correct approach, which involves assessing the patient's airway, breathing, and circulation, ABCs, first, represents best professional practice because it aligns with fundamental principles of emergency care and patient safety. This systematic approach ensures that life-threatening conditions are addressed immediately. In the context of ADV, compromised breathing due to pulmonary edema is a primary concern, directly impacting oxygenation and circulation. Promptly administering oxygen and positioning the patient to facilitate breathing addresses the most immediate threat to life, as mandated by nursing scope of practice and patient safety standards that emphasize prioritizing interventions based on physiological stability. Incorrect approaches analysis. One incorrect approach would be to immediately administer prescribed diuretics without first assessing the patient's respiratory status. This fails to adhere to the principle of prioritizing ABCs. While diuretics are a cornerstone of ADV management, administering them without ensuring adequate oxygenation could exacerbate respiratory distress or be ineffective if the underlying issue is severe hypoxemia. This approach could violate regulatory guidelines related to safe medication administration and patient assessment, potentially leading to adverse patient outcomes. Another incorrect approach would be to focus solely on the patient's reported chest pain, without a comprehensive assessment of their respiratory and hemodynamic status. Chest pain is a significant symptom. In ADV, it can be secondary to myocardial strain or hypoxemia. Neglecting the ABCs in favor of a single symptom, however distressing, deviates from best practice and could delay critical interventions for life-threatening respiratory compromise. This could be seen as a failure to meet the standard of care for managing acute cardiovascular conditions. A third incorrect approach would be to delay notifying the physician until after completing a full set of vital signs and administering the prescribed diuretic. Timely communication with the interdisciplinary team is crucial in managing acute conditions. Delaying notification when a patient presents with signs of ADV, such as dyspnea and crackles, could impede prompt medical management and potentially lead to a worse patient outcome. This could be considered a breach of professional responsibility and a failure to adhere to communication protocols established for patient safety. Professional reasoning. Professionals should employ a systematic, evidence-based approach to patient assessment and intervention. This involves prioritizing actions based on the ABCs, recognizing the urgency of the patient's condition, and understanding the pathophysiology of the cardiovascular disorder. A critical thinking framework that integrates assessment, diagnosis, planning, implementation, and evaluation, ADPI, is essential. In acute situations, the initial assessment and prioritization phase is paramount. Professionals must also understand their scope of practice, the importance of interdisciplinary collaboration, and the regulatory requirements that govern patient care and safety. When faced with a patient exhibiting signs of ADV, the immediate priority is to ensure adequate oxygenation and ventilation, followed by addressing hemodynamic instability and symptom management, all while maintaining clear and timely communication with the medical team. Question 13. Quality control measures reveal a registered nurse on the medical surgical unit failing to perform hand hygiene before entering a patient's room and before touching a clean supply cart. The nurse is observed by another registered nurse. What is the most appropriate immediate action for the observing nurse to take? Option A. Discreetly approach the colleague after the observed breach and privately remind them of the facility's hand hygiene policy, offering to assist if needed. Option B. Document the observation in a personal notebook for future reference but take no immediate action. Option C. Continue to observe the nurse's practice throughout the shift without intervening. Option D. Immediately report the observed breach to the unit manager without speaking to the colleague directly. Correct answer is A. Discreetly approach the colleague after the observed breach and privately remind them of the facility's hand hygiene policy, offering to assist if needed. Explanation. Scenario analysis. This scenario presents a common but critical challenge in medical surgical nursing, ensuring consistent adherence to infection control protocols in a busy unit. The challenge lies in the potential for complacency, time pressures, and individual variations in practice that can compromise patient safety. The nurse's responsibility extends beyond personal practice to actively promoting and reinforcing best practices among colleagues, requiring strong communication, observational, and intervention skills. Correct approach analysis. The most effective approach involves a multifaceted strategy that prioritizes direct, respectful, and evidence-based intervention. This aligns with the core principles of patient safety and regulatory compliance mandated by Nursing Practice Acts and infection control guidelines, such as those from the Centers for Disease Control and Prevention, CDC, which are foundational in U.S. healthcare. Directly addressing the observed breach with the colleague, referencing specific protocols, and offering support or education reinforces accountability and promotes immediate correction. This proactive and collaborative approach minimizes risk to patients and upholds the professional standard of care. Incorrect approaches analysis. Failing to address the observed breach directly or in a timely manner constitutes a significant ethical and regulatory failure. It implies a lack of professional accountability and a disregard for patient safety, potentially violating facility policies and nursing practice standards that require reporting or intervening in unsafe practices. This inaction can lead to the spread of healthcare-associated infections, which have serious consequences for patients and are a focus of regulatory oversight. Reporting the colleague to a supervisor without first attempting a direct, professional conversation can be perceived as an escalation that bypasses opportunities for peer-to-peer learning and problem-solving. While reporting is sometimes necessary, it can damage team cohesion and may not be the most efficient or constructive first step, particularly for minor or potentially unintentional breaches. This approach might be seen as circumventing established communication channels and could be viewed as unprofessional if not handled with appropriate discretion and justification. Ignoring the breach entirely is the most egregious failure. It demonstrates a profound lack of professional responsibility and a disregard for patient well-being and established infection control standards. This passive approach directly contributes to the risk of HAIs and can have severe legal and ethical ramifications for the nurse and the healthcare facility. It is a clear violation of the nurse's duty to advocate for patient safety and adhere to all applicable regulations and guidelines. Professional reasoning. When faced with observed breaches in infection control, a nurse should employ a structured decision-making process. First, assess the immediate risk to the patient and others. Second, consider the nature and severity of the breach. Third, attempt direct, respectful, and private communication with the colleague, referencing specific protocols and offering support. If the breach is severe, repeated, or if direct communication is ineffective or unsafe, then escalate the concern through appropriate channels, such as a charge nurse or infection control department, following facility policy. This process prioritizes patient safety while fostering a culture of accountability and continuous improvement. Question 14. Process analysis reveals a 72-year-old male patient, post-abdominal surgery, presenting with a surgical incision that shows no signs of healing after 14 days. The wound bed is pink, with minimal granulation tissue, and no purulent drainage is observed. The patient reports mild, intermittent pain at the site and has a history of type 2 diabetes mellitus, managed with oral medication, and a recent unintentional weight loss of 10 pounds over the past 2 months. What is the most appropriate initial nursing action to address this delayed wound healing? Option A. Document the findings and reassure the patient that delayed healing is common in older adults with diabetes. Option B. Increase the frequency of sterile dressing changes to twice daily to promote a moist wound environment. Option C. Conduct a comprehensive nutritional assessment and review the patient's glycemic control in addition to a detailed wound assessment. Option D. Apply a new advanced wound dressing with antimicrobial properties to the current dressing. The correct answer is C. Conduct a comprehensive nutritional assessment and review the patient's glycemic control in addition to a detailed wound assessment. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in medical surgical nursing, managing a patient with a non-healing surgical wound. The professional challenge lies in accurately assessing the multifactorial nature of impaired wound healing, which can stem from local factors, infection, pressure, poor nutrition, and systemic factors, underlying comorbidities, immune status. A nurse must synthesize clinical data, patient history, and current evidence-based practices to formulate an effective plan of care. The urgency of preventing further complications, such as deep tissue injury or systemic infection, necessitates prompt and accurate intervention. Correct approach analysis. The correct approach prioritizes a comprehensive, evidence-based assessment to identify the root cause of the delayed healing. This aligns with the core principles of nursing practice as outlined by the American Nurses Association ANA, Standards of Practice, specifically the Assessment Standard, which mandates the collection of health data. Furthermore, it reflects the ANA's standards of professional performance, particularly quality of practice and evidence-based practice and research, emphasizing the nurse's responsibility to use current knowledge and research to guide practice. Identifying and addressing the underlying cause, such as a localized infection or inadequate nutritional support, is crucial for promoting the inflammatory and proliferative phases of healing. This approach is ethically sound, upholding the principle of beneficence by acting in the patient's best interest and non-maleficence by preventing further harm. Incorrect approaches analysis. One incorrect approach involves solely focusing on topical wound care without a thorough systemic assessment. This fails to address potential underlying issues like uncontrolled diabetes or malnutrition, which significantly impede healing. Ethically, this approach could be considered a breach of the duty of care, as it does not fully investigate the cause of the problem, potentially leading to prolonged suffering and increased risk of complications for the patient. It also violates the ANA's standards of practice regarding assessment and diagnosis, as it does not involve a complete and accurate assessment. Another incorrect approach is to assume the delay is solely due to the patient's age and accept it as an unavoidable outcome. This demonstrates a lack of critical thinking and a failure to advocate for the patient. Age is a factor, but it does not preclude effective interventions. This approach neglects the ANA's standards of professional performance, specifically advocacy, which requires nurses to advocate for the patient's health needs. It also falls short of the ethical principle of justice, as it may lead to differential treatment based on age rather than clinical need. A third incorrect approach is to increase the frequency of dressing changes without a clear rationale or assessment of the wound bed. While frequent dressing changes can be indicated in certain situations, doing so without understanding the underlying cause of delayed healing can disrupt the delicate healing process, introduce contaminants, and cause unnecessary pain and expense. This approach lacks the systematic, evidence-based decision-making required by the ANA's standards of practice, particularly the planning and implementation standards, which mandate the development of a plan based on assessment and the implementation of interventions that are safe and effective. Professional reasoning. Professionals should employ a systematic approach to patient care. This begins with a thorough and ongoing assessment, gathering subjective and objective data. Next, a nursing diagnosis is formulated based on the assessment findings. Following diagnosis, a plan of care is developed, incorporating evidence-based interventions and patient goals. Implementation of the plan involves carrying out the interventions. And finally, evaluation assesses the effectiveness of the plan and leads to revisions as needed. In cases of delayed wound healing, this process necessitates a multidisciplinary approach, often involving consultation with wound care specialists, dietitians, and physicians to address all contributing factors. Question 15. Stakeholder feedback indicates that some registered nurses are experiencing challenges when patients express significant anxiety or reluctance during the physical examination process, particularly when it involves sensitive areas or requires disrobing. This feedback highlights a need to reinforce best practices in patient assessment and communication within the medical surgical setting. Option A. Postpone the physical examination until the patient's anxiety subsides naturally, without actively exploring the reasons for their reluctance or offering alternative strategies. Option B. Acknowledge the patient's anxiety but proceed with the examination promptly to avoid delaying necessary diagnostic information, focusing on efficiency. Option C. Explain the purpose and importance of each component of the physical examination to the patient. Answer their questions thoroughly and offer to perform the examination in stages or with a chaperone if they remain uncomfortable. Option D. Proceed with the physical examination as per protocol, reassuring the patient that it is a standard procedure and necessary for their care, without further detailed explanation or negotiation. The correct answer is C. Explain the purpose and importance of each component of the physical examination to the patient, answer their questions thoroughly, and offer to perform the examination in stages or with a chaperone if they remain uncomfortable. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the patient's immediate comfort and privacy with the critical need for a thorough physical examination to identify potential complications. The patient's reluctance introduces a conflict between patient autonomy and the nurse's professional responsibility to provide safe and effective care. The nurse must navigate this delicate situation by employing effective communication and assessment skills while adhering to professional standards and patient rights. Correct approach analysis. The correct approach prioritizes patient education and consent while ensuring the examination is performed safely and effectively, explaining the rationale for each step of the examination, allowing the patient to ask questions, and offering to perform the examination in stages or with a chaperone addresses the patient's concerns and promotes trust. This aligns with the ethical principles of beneficence, acting in the patient's best interest, autonomy, respecting the patient's right to make decisions, and non-maleficence, avoiding harm. Furthermore, it adheres to regulatory guidelines that mandate informed consent and patient-centered care. Incorrect approaches analysis. Performing the examination without fully addressing the patient's concerns or obtaining explicit consent risks violating the patient's autonomy and could lead to a breach of trust. This approach fails to uphold the principle of informed consent, a cornerstone of ethical and legal healthcare practice. It may also lead to the patient becoming more resistant or anxious, hindering future assessments, delaying the examination indefinitely without a clear plan to re-engage the patient or seeking assistance from other healthcare professionals could compromise patient safety. This approach neglects the nurse's duty of care and the principle of beneficence, as potential health issues might go undetected, leading to adverse outcomes. It also fails to proactively manage patient concerns, which is a key aspect of professional nursing. Proceeding with the examination forcefully or dismissively disregards the patient's expressed discomfort and right to privacy. This is a direct violation of ethical principles and potentially legal statutes related to patient rights and dignity. Such an approach can cause significant psychological distress to the patient and damage the nurse-patient relationship, potentially leading to formal complaints or legal action. Professional reasoning. Professionals should utilize a decision-making framework that begins with active listening and empathetic communication to understand the patient's concerns. This should be followed by clear, concise education about the purpose and necessity of the examination, addressing any misconceptions. The nurse should then collaboratively develop a plan with the patient, offering choices where possible, e.g., timing, presence of a chaperone, to foster a sense of control and cooperation. If concerns persist or are complex, seeking consultation with a supervisor or interdisciplinary team is a crucial step in ensuring optimal patient care and navigating ethical dilemmas. Question 16. Implementation of a health promotion strategy for a patient newly diagnosed with type 2 diabetes, focusing on risk assessment, involves which of the following initial nursing actions? Option A. Providing the patient with a comprehensive textbook on diabetes management and scheduling a follow-up appointment in 1 month. Option B. Assessing the patient's current understanding of diabetes, their perceived barriers to lifestyle changes, and their readiness to learn about self-management. Option C. Explaining the long-term complications of uncontrolled diabetes in detail to emphasize the urgency of adherence. Option D. Delegating the initial patient education session to a newly graduated nurse to allow the experienced nurse to manage other critical patient needs. The correct answer is B. Assessing the patient's current understanding of diabetes, their perceived barriers to lifestyle changes, and their readiness to learn about self-management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the patient's immediate need for information with their cognitive capacity and potential for anxiety. The nurse must assess the patient's readiness to learn and tailor the education to their understanding, ensuring comprehension without overwhelming them. This requires astute observation, empathetic communication, and adherence to patient advocacy principles. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient-centered care and effective health promotion. By assessing the patient's readiness and understanding, the nurse ensures that the education provided is relevant, comprehensible, and actionable. This aligns with the ethical principle of beneficence, ensuring the patient receives information that will promote their well-being and autonomy by empowering them to make informed decisions about their health. Regulatory frameworks for nursing practice emphasize the importance of patient education as a core competency, requiring nurses to deliver information in a manner that facilitates patient understanding and engagement. Incorrect approaches analysis. One incorrect approach involves providing a comprehensive, detailed pamphlet without assessing the patient's current understanding or readiness to learn. This fails to meet the regulatory requirement of providing patient education in a manner that is understandable to the patient. It can lead to information overload, anxiety, and a lack of retention, thereby failing to promote health effectively. Ethically, it neglects the principle of non-maleficence by potentially causing distress. Another incorrect approach is to assume the patient understands the information after a brief verbal explanation, without seeking confirmation. This overlooks the professional responsibility to ensure comprehension, a key component of effective patient education mandated by nursing practice standards. It can lead to the patient acting on misinformation or incomplete understanding, potentially compromising their health outcomes and violating the principle of patient advocacy. A third incorrect approach is to delay education until the patient is discharged, citing time constraints. This directly contravenes the proactive nature of health promotion and patient education, which should ideally begin as soon as a need is identified. Regulatory guidelines often stipulate that patient education should be an ongoing process, integrated into the patient's care plan, not an afterthought. Delaying education can impede the patient's ability to implement necessary lifestyle changes or self-care practices post-discharge, impacting their recovery and long-term health. Professional reasoning. Professionals should employ a systematic approach to patient education. This involves 1. Assessing the patient's current knowledge, beliefs, and readiness to learn. 2. Identifying learning needs and goals collaboratively with the patient. 3. Planning the educational content and method of delivery, considering the patient's learning style, cultural background, and cognitive abilities. 4. Implementing the education using clear, concise language and appropriate resources. And 5. Evaluating the patient's understanding and ability to apply the information, providing reinforcement and follow-up as needed. This iterative process ensures that education is effective, patient-centered, and aligns with professional and regulatory expectations. Question 17. Risk assessment procedures indicate that a 68-year-old male patient admitted for a scheduled orthopedic surgery reports experiencing a sharp, stabbing pain in his left calf, rating it a 7 out of 10. His vital signs are currently stable, with a blood pressure of 130/80 mmHg, heart rate of 78 bpm, respiratory rate of 16 breaths/min, and oxygen saturation of 98% on room air. His left calf appears slightly edematous and warm to the touch, but there is no visible redness or bruising. He denies any recent trauma or prolonged immobility prior to admission. What is the most appropriate initial nursing action to comprehensively assess this patient's pain? Option A. Administer a prescribed opioid analgesic immediately to alleviate the patient's reported severe pain. Option B. Perform a focused physical examination of the left lower extremity, including palpation for tenderness, assessment of pulses and range of motion, while continuing to ask clarifying questions about the pain's characteristics and any associated symptoms. Option C. Document the patient's pain rating and vital signs, and inform the physician that the patient is experiencing pain but objective findings are minimal. Option D. Reassure the patient that his vital signs are stable and that pain is subjective, suggesting he try to relax and focus on his upcoming surgery. Correct answer is B. Perform a focused physical examination of the left lower extremity, including palpation for tenderness, assessment of pulses and range of motion, while continuing to ask clarifying questions about the pain's characteristics and any associated symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in medical surgical nursing, where a patient's subjective report of pain conflicts with objective findings, requiring the nurse to synthesize multiple data points to accurately assess the patient's condition. The challenge lies in moving beyond a superficial interpretation of symptoms to a comprehensive understanding of the patient's physiological and psychological state, ensuring patient safety and effective care planning. The nurse must consider potential underlying causes that may not be immediately apparent. Correct approach analysis. The correct approach involves a systematic and holistic assessment that integrates subjective data, patient's pain report, with objective data, vital signs, physical examination findings, and patient history. This approach aligns with the nursing process, which mandates thorough assessment as the foundation for all subsequent nursing actions. Specifically, it adheres to the standards of practice for registered nurses, emphasizing the collection of comprehensive data to determine the patient's health status. This includes utilizing a variety of assessment techniques, such as a detailed pain assessment using a validated tool, a focused physical examination of the affected area, and a review of relevant medical history and current medications. This comprehensive method ensures that all potential contributing factors to the patient's pain are considered, leading to a more accurate diagnosis and effective treatment plan, in accordance with ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves solely relying on objective data, such as normal vital signs, to dismiss the patient's reported pain. This fails to acknowledge the subjective nature of pain and can lead to undertreatment, violating the ethical principle of respecting patient autonomy and their right to be heard. It also neglects the possibility that pain can exist without significant changes in vital signs, especially in chronic conditions or early stages of acute issues. Another incorrect approach is to focus exclusively on the patient's verbal report without further objective investigation. While subjective data is crucial, it must be corroborated and contextualized. Ignoring objective findings could lead to misdiagnosis or overlooking serious underlying pathology that the patient may not be fully aware of or able to articulate. This approach lacks the rigor required for safe and effective nursing practice. A third incorrect approach is to immediately administer pain medication based solely on the patient's report without a thorough assessment. This bypasses the critical step of identifying the cause of the pain and assessing its characteristics. While pain relief is a priority, it must be guided by a comprehensive understanding of the patient's condition to ensure appropriate medication selection, dosage, and to avoid masking symptoms of a more serious problem. This can also lead to polypharmacy or inappropriate medication use, which are regulatory concerns. Professional reasoning. Professionals should employ a structured decision-making process that begins with recognizing the patient's subjective complaint as a valid data point. This should trigger a systematic assessment that includes a detailed pain history, onset, location, duration, character, aggravating/alleviating factors, radiation, timing, severity, a focused physical examination of the relevant body system, a review of the patient's medical history and current medications, and a reassessment of vital signs. The nurse should then synthesize all collected data to form a nursing diagnosis and develop an individualized care plan. This iterative process of assessment, diagnosis, planning, implementation, and evaluation ensures that patient care is evidence-based, patient-centered, and ethically sound. Question 18. Investigation of a patient presenting with polyuria, polydipsia, and unexplained weight loss requires a systematic nursing assessment to differentiate between potential endocrine etiologies. Which of the following assessment approaches best aligns with current nursing practice standards and regulatory guidelines for managing patients with suspected endocrine disorders? Option A. A comprehensive assessment including a detailed health history, review of current medications, a thorough physical examination focusing on endocrine-related signs and symptoms, and a review of recent laboratory values. Option B. An assessment that prioritizes immediate administration of intravenous fluids based on the polyuria without a complete diagnostic workup. Option C. An assessment that relies on information gathered from online patient forums and anecdotal advice from other nurses regarding common endocrine symptoms. Option D. A focused assessment primarily on the patient's reported thirst and urine output, assuming a diagnosis of diabetes insipidus without further investigation. The correct answer is A. A comprehensive assessment including a detailed health history, review of current medications, a thorough physical examination focusing on endocrine-related signs and symptoms, and a review of recent laboratory values. Explanation. This scenario is professionally challenging due to the critical nature of endocrine disorders and the potential for rapid deterioration if management is suboptimal. Patients with conditions like diabetes mellitus or thyroid disorders require vigilant monitoring and individualized care plans. The nurse must synthesize complex information, anticipate potential complications, and advocate effectively for the patient within the established regulatory framework governing nursing practice. The correct approach represents best professional practice because it prioritizes a holistic, evidence-based assessment that directly addresses the patient's current physiological status and potential risks. This aligns with the American Nurses Association (ANA) standards of practice, particularly those related to assessment, diagnosis, planning, implementation, and evaluation. Specifically, it adheres to the principle of obtaining a comprehensive history and performing a thorough physical examination to identify specific manifestations of the endocrine disorder and its impact on the patient's overall health. This proactive and individualized approach ensures that nursing interventions are tailored to the patient's unique needs, promoting optimal outcomes and patient safety, which are paramount under the Nurse Practice Act of the relevant state. An incorrect approach that focuses solely on a single symptom without a comprehensive assessment fails to meet the standard of care. This could lead to misdiagnosis or delayed recognition of serious complications, violating the nurse's ethical and legal duty to provide competent care. Such an approach might also overlook crucial psychosocial factors or comorbidities that significantly influence the management of endocrine disorders, potentially leading to suboptimal treatment and patient harm. This would be a failure to adhere to the ANA Code of Ethics for Nurses, which emphasizes the nurse's responsibility to provide care based on the patient's needs and to advocate for their well-being. Another incorrect approach that relies on outdated or unverified information from non-professional sources bypasses established protocols and evidence-based practice guidelines. This poses a significant risk to patient safety and violates the regulatory requirement for nurses to practice within their scope and to utilize current, reliable knowledge. Relying on anecdotal evidence or non-peer-reviewed information can lead to the implementation of ineffective or even harmful interventions, directly contravening the Nurse Practice Act's mandate for safe and competent nursing practice. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the patient's presenting signs and symptoms. 2. Access and review the patient's medical record for relevant history, laboratory data, and current orders. 3. Conduct a comprehensive physical and psychosocial assessment, focusing on the endocrine system and its impact on other body systems. 4. Consult evidence-based practice guidelines and institutional protocols for the specific endocrine disorder. 5. Collaborate with the interdisciplinary healthcare team, including physicians, pharmacists, and dietitians, to develop and implement a safe and effective care plan. 6. Continuously monitor the patient's response to interventions and adjust the plan of care as needed, documenting all findings and actions. This iterative process ensures that care remains patient-centered, evidence-based, and compliant with all regulatory and ethical standards. Question 19. The evaluation methodology shows that a registered nurse is assessing a patient's risk for developing integumentary disorders. Which of the following approaches to risk assessment is most aligned with current best practices and regulatory expectations for a certified medical surgical registered nurse? Option A. Relying primarily on the patient's subjective report of skin sensation and comfort levels. Option B. Focusing exclusively on the patient's mobility status as the sole determinant of risk. Option C. Conducting a comprehensive assessment that integrates intrinsic patient factors, extrinsic environmental factors, and the impact of medical devices. Option D. Prioritizing interventions based on the patient's primary diagnosis and length of hospitalization. The correct answer is D. Prioritizing interventions based on the patient's primary diagnosis and length of hospitalization. Explanation. Scenario analysis. This scenario presents a challenge in accurately assessing the risk of skin breakdown in a patient with multiple contributing factors. The nurse must synthesize information from various sources, including the patient's medical history, current condition, and environmental factors. Identify individuals at highest risk. Failure to conduct a thorough and accurate risk assessment can lead to delayed or inadequate interventions, potentially resulting in preventable complications such as pressure injuries, which can significantly impact patient outcomes, increase healthcare costs, and violate standards of care. Correct approach analysis. The correct approach involves a comprehensive, multifaceted risk assessment that considers intrinsic patient factors, e.g., immobility, nutritional status, sensory perception, moisture, friction and shear, and extrinsic factors, e.g., medical devices, frequency of repositioning. This aligns with best practices in nursing care, as outlined by professional nursing organizations and regulatory bodies that emphasize evidence-based risk assessment tools and individualized care planning. For example, the National Pressure Injury Advisory Panel, NPIAP guidelines, which are foundational in U.S. healthcare for pressure injury prevention, advocate for systematic assessment using validated tools. This approach ensures that all potential risk factors are identified and prioritized, leading to the development of a targeted and effective prevention plan, thereby upholding the nurse's duty of care and adherence to professional standards. Incorrect approach is analysis. Focusing solely on a single risk factor, such as immobility, is an incomplete assessment. This approach fails to acknowledge the synergistic effect of multiple risk factors. For instance, a patient who is mobile but also has poor nutrition and is exposed to moisture from incontinence is still at significant risk, which would be missed by a singular focus. This constitutes a failure to meet the standard of care by not performing a comprehensive assessment, potentially leading to a violation of nursing practice acts that require competent and thorough patient evaluation. Relying exclusively on the patient's self-report of comfort without objective assessment is also inadequate. While patient input is valuable, it may not always reflect underlying physiological risks. A patient might not perceive early signs of skin compromise or may have altered sensory perception due to their condition. This approach risks overlooking critical indicators of impending skin breakdown, which is a breach of the nurse's responsibility to advocate for and protect the patient's well-being, potentially violating ethical principles of beneficence and non-maleficence. Ignoring the impact of medical devices on skin integrity is another critical failure. Devices like oxygen tubing, urinary catheters, or orthopedic braces can create localized pressure and friction, leading to device-related pressure injuries. A risk assessment that does not specifically evaluate these areas is incomplete and fails to address a common cause of skin compromise, thereby not meeting the expected standard of care for patients utilizing such equipment. This oversight could lead to preventable harm and a deviation from established protocols for device management. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough understanding of the patient's overall health status and specific risk factors for integumentary disorders. This involves utilizing validated risk assessment tools, e.g., Braden scale for pressure injury risk, conducting a head-to-toe skin assessment, and gathering data from the patient, family, and electronic health record. The collected data should then be analyzed to identify patterns and prioritize interventions. This iterative process of assessment, planning, intervention, and evaluation ensures that care is individualized, evidence-based, and responsive to the patient's changing needs, thereby promoting optimal patient outcomes and adhering to regulatory and ethical mandates. Question 20. The assessment process reveals a competent adult patient who has clearly expressed a desire to refuse a life-sustaining treatment, despite their family's strong emotional pleas and insistence that the patient would want to continue treatment if they were able to fully understand the situation. The patient reiterates their decision with clarity and understanding of the potential consequences. Option A. Override the patient's decision based on the family's distress and their belief that the patient would change their mind and proceed with the life-sustaining treatment. Option B. Document the patient's refusal of treatment, ensure they understand the consequences, and continue to advocate for their expressed wishes by facilitating communication between the patient, family, and the healthcare team. Option C. Withhold further discussion about the treatment refusal with the patient to avoid upsetting them further and focus on managing the family's anxiety. Option D. Inform the family that the patient's decision is final and refuse to involve yourself further in the situation, leaving the family to manage their own communication with the patient and healthcare team. Correct answer is B. Document the patient's refusal of treatment, ensure they understand the consequences, and continue to advocate for their expressed wishes by facilitating communication between the patient, family, and the healthcare team. Explanation. The assessment process reveals a complex ethical and legal situation where a patient's expressed wishes conflict with the perceived best interests of their family and potentially with established medical standards of care. This scenario is professionally challenging because it requires the nurse to navigate competing ethical principles, such as patient autonomy versus beneficence, while adhering to legal mandates regarding informed consent, patient rights, and professional conduct. The nurse must balance the patient's right to self-determination with the family's emotional distress and their desire for a specific outcome, all within the bounds of regulatory frameworks governing nursing practice. The correct approach prioritizes the patient's autonomy and right to informed consent. This aligns with the fundamental ethical principle of respect for persons and is legally mandated. The nurse's responsibility is to ensure the patient has the capacity to make decisions and that their choices are based on adequate information. By facilitating communication between the patient, family, and healthcare team, and by advocating for the patient's expressed wishes, the nurse upholds professional standards and legal requirements. This approach respects the patient's dignity and legal standing as the primary decision-maker for their own care. An incorrect approach that involves overriding the patient's wishes based on family pressure or the nurse's personal judgment of what is best violates the principle of patient autonomy and the legal requirement for informed consent. This could lead to accusations of battery or negligence. Another incorrect approach, such as unilaterally withholding information from the patient to appease the family or to avoid conflict, breaches the nurse's duty of honesty and transparency and undermines the patient's right to make informed decisions. This also fails to uphold the nurse's professional and legal obligation to advocate for the patient. A further incorrect approach, such as abandoning the patient or refusing to participate in care due to ethical discomfort without proper delegation or consultation, could be construed as professional misconduct and a failure to provide necessary care. Professional decision-making in such situations requires a systematic approach. First, assess the patient's decision-making capacity. If capacity is present, the patient's wishes are paramount. Second, facilitate open and honest communication among the patient, family, and healthcare team, ensuring all parties understand the patient's condition, treatment options, and prognosis. Third, advocate for the patient's autonomy and ensure their informed consent is obtained and respected. Fourth, consult with the interdisciplinary team, including physicians, social workers, and ethics committees, to address complex ethical dilemmas and ensure all legal and ethical obligations are met. Finally, document all assessments, communications, and decisions thoroughly.